I'm Paul Rosano and I work as a compliance specialist in OHA's hospital staffing program. OHA's hospital staffing complaint system is how Oregon's hospital staffing law, including the updates in 2023's House Bill 2697, are enforced in Oregon. In this video, we will provide a quick overview of the hospital staffing mandatory overtime laws. Under Oregon Revised Statute 441770, a hospital may not require a nursing staff member to work beyond the agreed upon and prearranged shift more than 48 hours in any hospital-defined work week during the 10-hour period immediately following the 12th hour worked, or during the 10-hour period immediately following any agreed upon and prearranged shift where the nurse worked more than 12 hours in a 24-hour period. This law applies to nursing staff members, including registered nurses, licensed practical nurses, and certified nursing assistants. If a hospital mandates that employees work additional hours as a condition of their employment, this constitutes mandatory overtime and would be a violation of the provisions described in ORS 441770. Mandatory overtime does not include voluntary overtime or call shifts when the nursing staff member has selected that call shift. Oregon Revised Statute 441770, subsection 4, permits up to 1 hour of mandatory overtime in two specific circumstances. These circumstances are: a staff vacancy for the next shift becomes known at the end of the current shift, or there's a potential harm to an assigned patient if the nursing staff member leaves the assignment or transfers care to another nursing staff member. In summary, mandatory overtime is permitted for up to a 1 hour limit to cover the first hour of a shift when an unexpected staff vacancy becomes known at the end of the current shift, or when there's a risk of harm to a patient if nursing staff were to transfer care at the end of the shift. If the work continues beyond 1 hour, that would no longer be permitted mandatory overtime. It would either be voluntary overtime if the nursing staff member agrees to continue working, or it would be mandatory overtime in violation of the law. Nursing staff members have the option to volunteer for overtime shifts. When staffing needs exceed the number of scheduled personnel, the nursing staff members may choose to work additional hours beyond their regular schedule. In mandatory overtime investigations, OHA looks for documentation that includes the type of overtime, along with the date, time, and for permitted overtime of 1 hour or less reasons for the extra hours worked. For instance, the documentation should clearly reflect the overtime was necessitated by a risk of harm to a patient if the nursing staff member were to transfer care at the end of the shift. For more information, visit www.healthoregon.org/hospital staffing for OHA's FAQ, webinars, and other resources.